Welcome to the Ingham Health Plan. Whether you are new to Ingham Health Plan or a longtime member, we thought it might be helpful to provide a member orientation. The information referenced in this presentation can also be found in your welcome guide, the member guidebook, or on our website. Here is an overview to the benefits available to you as an Ingham Health Plan member. Ingham Health Plan provides basic health coverage. With IHP, you can go to the doctor for office visits, preventive services, and mental health support, receive specialty services and outpatient labs, x-rays and tests, get the medicines you need to manage your health conditions, and see a dentist. We are going to talk more about each of these benefits. Every Ingham Health Plan member is assigned to a participating primary care doctor's office, family doctor, at the time of enrollment. The name of your assigned clinic can be found on your IHP member card. You should see this clinic for your primary care needs like routine illness or injury, follow-up care, vaccines, and annual physicals. In case of an illness or injury, IHP encourages you to contact your doctor's office first for directions on where you should go for care. Most doctor's offices have someone on call who can give you advice 24 hours a day. If you can't get into this clinic for care, you can go to a walk-in clinic or urgent care clinic. These are not the emergency room. The walk-in clinic may be an option if you have cold and flu symptoms, sore throat, ear infection, urinary tract infections, vomiting and diarrhea, insect bites, minor burns, minor rashes, and wound care. The urgent care can see you for illnesses or injuries that require immediate attention, but not serious enough for the emergency room. These might include muscle sprain or strain, treatment for minor broken bones, cuts and scrapes, x-rays, and stitches. There are a number of urgent care clinics that accept IHP. You can find a list on our website. A reminder, the emergency room should be used only in emergencies. Situations like trouble breathing, chest pain, head injury, and any time you believe your life or health is in jeopardy. The ER is not a covered service by IHP. Additional items to mention. In some cases, you may want to use telehealth instead of going in person for care. Telehealth involves using your phone or computer to communicate with a doctor. Ask your doctor if telehealth is an option. Once per year, you can ask to be transferred or reassigned to another participating doctor's office or medical clinic in the community. Another benefit of IHP is that you have access to specialty care office visits. You may need to visit a specialty care provider for services such as podiatry, gastroenterology, hematology, cardiology, or OB/GYN, just to name a few. Your mental health is very important to us. If you have questions or concerns about your mood or emotions, please talk to your family doctor or primary care provider. They can help you decide if therapy would be helpful. There are several local therapists that will see Ingham Health Plan members. Outpatient surgeries, labs, and radiology are covered services under IHP. It is important to remember that inpatient services aren't covered. Inpatient services generally require you to stay at least one night in the hospital. You have access to up to 20 visits per calendar year for physical and occupational therapy, but this does require an authorization from your doctor before you can get OT or PT services. Most immunizations, vaccines, infusion services, and injectable medications are covered. This includes flu vaccine and other immunizations as recommended by the CDC. Radiation therapy is covered, however, chemotherapy is not. Any medically necessary eye exam and testing is covered. This is usually connected to a chronic illness, and your doctor will determine if it's medically necessary. Allergy testing, shots, and serums are covered. Lastly, sleep studies, CPAP machines, and supplies are covered. You may be required to pay a small copay at the time of service. Copays will be addressed in another slide. Ingham Health Plan members have access to prescription medications. However, not all medications are covered by IHP. IHP has a formulary that lists all the covered medicines. Most of the IHP medications are generic. Copay for generic medication is $5. Brand medication will cost you $10. The IHP formulary is subject to change. Medicines may be added and removed at any time. If you are asked to pay more than $10, this is not a medicine covered by IHP. Ask the pharmacist if there is a generic option, or you may be eligible to receive some non-covered medication for free through a prescription drug assistance program. Some drug manufacturers offer this type of program. Crystal Ray has staff available to assist IHP members with application to prescription drug assistance programs. With Ingham Health Plan, you also have dental coverage. The dental coverage is in partnership with Delta Dental EPO program. You should have received a separate Delta Dental card in the mail directly from Delta Dental. Your Ingham Health Plan member card will not work at the dentist. You will need the Delta Dental card to make an appointment to go to the dentist. Exams, cleanings, x-rays, fillings, crowns, root canals, bridges, and dentures are covered services. However, copays and deductibles will vary depending on service. Orthodontist is not covered. Some covered services require you to pay a small copay at time of service. The Ingham Health Plan has a $5 copay for office, specialty, and urgent care visits. There is also a copayment due for prescription medications. This is $5 for generic and $10 for brand name. Our Delta Dental EPO plan has copayments associated with dental services. These do vary, and we would recommend you check with your dentist before services are scheduled. There are some services that are not covered under the Ingham Health Plan. Those include hospital emergency room services, inpatient hospitalization, ambulance service, chiropractic services, any routine vision service, including glasses and contacts, pregnancy-related services, chemotherapy, procedures related to sterilization, dialysis and medications not on the Ingham Health Plan drug list. Sometimes you may need these services, but you are responsible for costs associated with these types of services. In some cases, you might qualify for financial assistance through the hospital, or local community agencies might be able to provide the service for free or low cost. Please contact IHP for resources if needed. This is not a complete list. For more details on this, please visit our website at www.ihpmi.org. IHP requires you to confirm your eligibility each year. You will receive a letter in the mail. If anything has changed, such as your income, household size, your address, or you obtain any type of health care insurance, you need to contact IHP. If we discover any eligibility criteria has changed or we can't deliver mail to your address, IHP may cancel your membership. There is a $20 administrative fee due the month after enrollment and then every year following. You will get an invoice that will be sent separately the month following enrollment. You can pay by check, money order, or credit card. We do not accept cash. For additional member resources, visit ihpmi.org, our website. You can find resources such as Member materials available in a variety of languages, enrollment materials to share with others that may qualify for IHP, pay your $20 admin fee when it's due, and access to the health portal. Speaking of health portal, you have access to a health portal. You can register for your online account by visiting our website and clicking on Portal Login. Through the portal, you have 24/7 access to your claim information, benefit plan details, member documents, and other helpful tools for managing your health. If you need to contact us, you can reach us by phone, email, or visit our website. Assistance in Spanish is available by selecting option 4 on the main menu. Thanks for being an Ingham Health Plan member. Please take a couple of minutes to complete a brief survey following this video and provide feedback about this orientation.